This is one of my favorite cues and things to look at when we're trying to improve somebody's shoulder mobility and trying to improve their ability to press weight or do shoulder press or some kind of horizontal press. We have to understand the relationship between the rib cage and the shoulder blade. We want to make sure that when somebody's pressing, the space between the ear and the shoulder doesn't close too soon, right? We don't shrug up too soon. Does it eventually close? Absolutely. But when it closes too soon, you end up with limitation of motion upward and limitation of ability to perform higher strength press, okay? So one of the reasons that can actually happen is because the rib cage may be a little bit flattened front to back. And when it's flattened front to back, what it ends up doing is if you imagine like a toilet paper roll and you stand it up vertically, and you squeeze it front to back this way and pretend it's a rib cage, what you're going to start seeing is you're going to start seeing a lot more of a narrow apex at the top, and you're going to see kind of more of a sharper corners on the outside. When the rib cage is supposed to be nice and round and cylindrical pretty much the whole way through, right? So when you're taking this nice cylindrical rib cage and you're turning it flat front to back, we are actually changing the ability for the shoulder blade to be able to, have a relationship there in a nice smooth motion. Because the shoulder blade itself is also slightly curved, right? So what ends up happening is because you've now flattened front to back, the ability for that shoulder blade to go around that corner you just created is a lot tougher. So it'll take a more vertical pathway this way. Not because you want to, but because of necessity. And generally when you're doing movements based on necessity rather than desire, they can sometimes have a negative effect. Now the second reason why could be motor control. A lot of people, especially when they're lifting heavier weights, just think, I just need to get the weight up. And if I shrug my shoulder, I'm moving my hand upward. So that's what I'm trying to do. But what we usually want for the shoulder to feel as healthy as possible and the most natural moving is the cue I like to give is instead of thinking going up the mountain, think about going around the mountain if you think of the top of the shoulder being the mountain. And what that'll do is if I'm using my man here, Bones, to press, is what that'll do is it'll allow that shoulder blade to come around and upwardly rotate to get to the top and not just elevate, right? Elevation is not a bad movement, so to say, but it can lead to tightness along the traps and reduce performance during pressing motion. So next time you have somebody with shoulder issues or shoulder mobility problems, or maybe it's you, go ahead and try those two things out and let me know what you think.